I'm Dr. William Audie. I'm a medical oncologist specialized in breast cancer and genomics, and I'm the Chief Medical Officer for Agendia. I'm also on the medical staff at the Cedars-Sinai Medical Center in Los Angeles. Genetic testing, which I think many people are quite familiar with, is where we're looking at inherited genes that may carry a risk, in the case of breast cancer, of developing breast cancer at a younger than average age. Genes such as the BRCA1 and 2 genes are commonly tested for in what we call genetic testing. This is done on a blood sample or a saliva sample and has nothing to do with a breast tumor itself. Genomic testing is still looking at genetic information, but it's looking specifically at the cancer cells and the genes that they carry. We're specifically looking for the patterns of genes that are on or off in a cancer that will help us predict its behavior. Not only whether it's likely to spread, but also what type of treatment may be most effective against it. I think the main use of genomic testing is actually to predict how likely it is that breast cancer has spread, because that will direct a doctor and a woman with breast cancer to determine just how aggressive treatment needs to be. If the genomic profile of the cancer predicts that it may have a high likelihood of spread, then you want to make sure that you're using adequate treatment to make sure that that has not happened. Or that if it has spread, that you make certain that those breast cancer cells will be killed by the treatment. So predicting the likelihood of recurrence is one of the main values of genomic testing in early stage breast cancer. Most genomic testing is done on early stage breast cancer soon after diagnosis, and that kind of testing can be done on the biopsy that made the diagnosis in the first place. In other words, you do not have to wait for the surgery to take the tumor entirely out. It's possible to perform genomic testing on the core biopsy itself. The best information we have so far is using genomic information in women who have hormone-positive, HER2-negative breast cancer. It is the most common type of breast cancer across all ages of women who develop breast cancer. And the information that's provided there is first used to decide whether chemotherapy is needed in addition to anti-estrogen therapy. Beyond that, we can also predict how long the estrogen therapy needs to continue. The pills that we ask women to take with hormone-positive breast cancer usually need to be taken for 5 years. But for some women, it may be helpful to take it for longer than 5 years. And for others, if they're having trouble with those medications, they may be able to stop early if they have a particularly low-risk genomic tumor. The genomic testing that's available now that a doctor could order on any person with breast cancer is based upon gene expression, which means that a sample of the tumor needs to be sent to a laboratory to analyze the genes that are turned on and genes that are turned off in that tumor. Examples of the kind of tests that can be ordered are the MammaPrint test, which looks at 70 genes, the Oncotype test, which looks at 21 genes, the Prosigna test, which looks at 50 genes, and there are some others. I think it's important to encourage any woman newly diagnosed with breast cancer to seek as much information as is available. Breast cancer, of course, is still a major problem in healthcare. Huge improvements have been made over the last many decades, and we're still making improvements. We still have a long way to go, but there's a great deal of new information that's now available through this technology of genomic testing. And I think it's essential that every woman with newly diagnosed breast cancer ask for it and ask for the best test to get the most information about her cancer.